Hello, my name is Dr. Dewan S. Raja. Today I will discuss about inguinal hernia. What is the definition of inguinal hernia? An inguinal hernia is the protrusion of the abdominal contents, often small intestine like ileum or pre-peritoneal fat through a weakness in the abdominal wall in the inguinal region. Inguinal region is the region between the abdomen and the upper part of the thigh. Okay, so it is a region between the lower part of the abdominal wall and the upper part of the thigh. Types of inguinal hernia, we have indirect inguinal hernia, direct inguinal hernia. These are mostly the problem of male, but there may be female inguinal hernia. Let's get about indirect inguinal hernia. Most common type, especially in children and young adults, protrude through the deep inguinal ring, which is a gap in the fascia transversalis, follow the inguinal canal, and comes out through the superficial inguinal ring. There is a gap in the aponeurosis of external oblique. It may enter the scrotum along with the spermatic cord. It is lateral to the inferior epigastric vessels. Etiology, patent processus vaginalis. There is congenital weakness because of the patency of the processus vaginalis. Is common in premature infants. How about direct inguinal hernia? Occurs in older men, that means men over the age of 40, protrude directly through the Hasselbeck's triangle, medial to the inferior epigastric vessels, rarely enters the scrotum. We have inguinal hernia in female, that is rare. Usually indirect, may contain ovary or fallopian tube, and that follows along with the round ligament of the uterus. So this is the part of the ileum. This is herniating through that, may go there. Indirect inguinal hernia. This is the internal spermatic fascia, and this is the transversalis fascia, and there is a gap here. Through this gap, the herniated sac is going into the inguinal canal, comes out through the superficial inguinal ring. That is a gap in the aponeurosis of external oblique. Then it is going down to the scrotum along with the spermatic cord. So if we look at the inguinal canal, we have two ring. This is the deep inguinal ring, that is a gap in the transversalis fascia, and we have a superficial inguinal ring, that is also called external inguinal ring. There is a gap in the aponeurosis of external oblique. So hernia goes through there, go through the inguinal canal, comes out through there, follow the spermatic cord, may go to the scrotum. So what are the differences between direct and indirect inguinal hernia? Indirect inguinal hernia passes through the entire inguinal canal. Direct inguinal hernia bulges from the posterior wall of the inguinal canal, and it pushes through the superficial inguinal ring. Can descend into the scrotum, can't descend into scrotum. Reduced upward, then laterally and backward, reduced upward, then straight back for in case of direct inguinal hernia. Indirect inguinal hernia controlled after reduction by pressure over the deep inguinal ring. Direct inguinal hernia not controlled after reduction by pressure over the internal inguinal ring, because the direct inguinal hernia don't go through the deep inguinal ring. The defect is not palpable. It is behind the fibers of the external oblique muscle. The indirect inguinal hernia, direct inguinal hernia defect may be felt in the abdominal wall above the pubic tubercle. After reduction, the bulge appears in the middle of the inguinal region. It reaches there through the deep inguinal ring, okay, and then follow medially before turning down to the scrotum. After reduction, the bulge reappears exactly where it was before. Common in children and young adults, indirect inguinal hernia. Common in old age, direct inguinal hernia. Okay, but what is Hasselbeck's triangle? A direct inguinal hernia passes through Hasselbeck's triangle. It is a triangle bounded by the lateral border of rectus abdominis here, above the inguinal ligament, and medial to the inferior epigastric artery. So this is the Hasselbeck's triangle. Any hernia or protrusion through this triangle is direct inguinal hernia. Any hernia lateral to the inferior epigastric artery and outside the Hasselbeck's triangle or inguinal triangle, that is indirect inguinal hernia. So this is the Hasselbeck's triangle. So any herniation along this is indirect, any herniation along this is direct inguinal hernia. So we got the boundary of Hasselbeck's triangle. You have to know some fact. Direct inguinal hernia protrude through the Hasselbeck's triangle that is bounded by rectus abdominis, inferior epigastric artery, and inguinal ligament. And indirect inguinal hernia does not protrude through the Hasselbeck's triangle. A direct inguinal hernia protrude medial to the inferior epigastric artery. Indirect inguinal hernia protrude lateral to the inferior epigastric artery. Risk factor for hernias: chronic cough, chronic obstructive pulmonary disease, smoking, chronic constipation, straining, heavy lifting, pregnancy, obesity or sudden weight loss, aging, facial weakness, family history, prematurity. These are the factors. Sometimes the factor is not known. Inguinal hernia, clinical feature: groin bulge, increase with standing, coughing, or valsalva. And this bulge disappears when a person lie down after sleep. In the morning, in the bed, it is not bulged out. Okay. Dull discomfort or heaviness, reducible initially if incarcerated, painful, non-reducible mass. If strangulated, severe pain, erythema, bowel obstruction syndrome, vomiting, distension happen. These are signs of intestinal obstruction due to strangulation of the hernial sac. And this is a surgical emergency. If the bowel is strangulated, twisted, then inside the hernial sac, then it is a surgical emergency. Diagnosis: clinical examination usually sufficient, but we sometimes need ultrasound for unclear cases, CT scan for obese and complicated cases. But most of the hernia is visible and it can be diagnosed clinically. We can differentiate direct inguinal hernia from indirect inguinal hernia. Management of hernias, inguinal hernia: elective repair recommended for symptomatic hernias. Technique: open mesh repair or laparoscopic repair. Mesh reduces recurrence. Emergency surgery, indication for incarceration or strangulation. Incarceration means it is a morbid adhesion with the sac in the content. The ileum is adhered to the sac of the hernia. Incarcerated. Strangulated, usually the intestine is twisted, it is maybe constricted the upper part of the sac, that is strangulation. That may lead to necrosis, initially lead to intestinal obstruction, then necrosis of that part because of lack of blood supply. And that's all about the inguinal hernia. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.